I love doing surgery. I love delivering babies, but days like today is why I got into medicine. I want to help women and I want to have relationships with patients that are meaningful and inspiring and helpful. And that's why I got into medicine. And days like today is exactly why. Sometimes in the hustle and bustle of medicine, we are overbooked, or we need to add on a patient for an emergency, or we get stuck in emergency surgery and we're running behind. I had several no-shows today, so I ended up only seeing 24 patients, which is why I got to spend a lot more quality time with patients. And I got to see a lot of my patients that I've been seeing for years. So lots of follow-up and lots of continuity, which is some of the best part of practicing OBGYN. I figured I'd tell you what I saw and took care of today so you can see what a real clinic day is like. I saw 4 new patients. This was mostly annuals getting established, but also one patient had severe menopausal symptoms and we were able to start her on therapy. And so 2 new pregnancies. I had 6 prenatal follow-ups. I saw 2 patients postpartum that I delivered. I saw 3 follow-ups to check in on medication management, to follow up an ultrasound. I saw 6 routine visits. So that's what we call our annual visits. So these are women that I see every year. We do their mammograms, we do pap smear if it's necessary. We talk about screening, we talk about life, make sure that they're doing well, get updates on their family, and continue to make sure that they are on appropriate medications and well cared for. And I got to do 3 procedures. I did 2 IUDs and an endometrial biopsy. I did cervical blocks on everybody, so these patients did not suffer. One of the patients at the end goes, "That was it? I was expecting way worse." And the other one had nitrous oxide, and she just kind of didn't care at all. And when I told her we were done, she just laughed and was like, "Wow, that was awesome." And it goes to show that taking care of women's pain matters, and that there's no reason that you can't do a cervical block, do some lidocaine, and desired, do some Pronox, which is nitrous oxide. Overall, a very fun day. I got to have lots of meaningful conversations. I got to have lots of continuity and see a patient that we've been trying to get pregnant for a long time and recently did endometriosis surgery on, and now she's pregnant. So that's exciting. Days like today are just rejuvenating. I love my job most days. Sometimes it's exhausting. It is 5:04. I had time to make a video. I had time to do all of my charting, finish all of my notes, and I'm going home on time to see my family. Probably a lot of rambling here, but I think people want to know why I got into medicine, and this is why. I like to have relationships with women that are meaningful, that give back, that counsel and help, and it's fun to take care of the patient long term.